30 years ago, there was a unanimous agreement in Cairo at the International Conference on Population and Development (ICPD) to secure the reproductive health and rights of all people. It is disappointing that progress is slow in every arena. The actual reduction in maternal deaths flatlined in the year 2016. In fact, the world has made no progress on saving women from dying needlessly while giving birth.
30 years ago, there was unanimous agreement in Cairo at the International Conference on Population and Development, ICPD, to secure the reproductive health and rights of all people. It is disappointing that progress is slowing in every arena. The annual reductions in maternal deaths flatlined. Since the year 2016, in fact, the world has made no progress on saving women from dying needlessly while giving life. And COVID, exposing the inequalities in the health system, is only a part of the reason.
Reports also says that an African woman is roughly 130 times more likely to die from pregnancy and childbirth complications than a woman in Europe or North America. Many of these findings is as a result of better data.
Many of these findings are the result of better data, and we join with those who are encouraging a speedy adoption of the new census process. Today, there are data to show us clearly unacceptable rates of difference. Some women are dying while giving life, and others have no access to life-saving services. The vast majority of maternal deaths, over 70%, take place in our beautiful continent, Africa.
Today, there are data to show us clearly unacceptable rates of difference. The vast majority of maternal deaths, over 70% in our beautiful continent, Africa. There has also been advances towards ending domestic violence, gender-based violence, and reduction in harmful practices here in Nigeria. Example is a drop of adolescent females subjected to the female genital mutilation, FGM, which have gone down by 10% in the past decade.
The remarkable reduction in terms of the number of women who were saved during pregnancy and childbirth was largely attributed to progress in India and in Nigeria. Nigeria's own contribution to reducing deaths during pregnancy and childbirth was more than 11% during the years from 2013 through 2018. Indeed, a big achievement. There have also been advances towards ending domestic violence, violence in the home, gender-based violence, and reductions in harmful practices here in Nigeria. For example, the drop in adolescent females being subjected to female genital mutilation has gone down by 10% in the past decade.
The Nigerian projected to become one of the world's most populous country in 2015. President Bola Tinubu, represented by the Minister of Health and Social Welfare, highlights the government's commitment to improve reproductive health and the welfare of the vulnerable society. He expresses his gratitude to the UN for selecting Nigeria for the program launch.
I want to assure you that we are taking bold steps and committed to addressing issues that affect our youth and reproductive health. And in December 2023, I launched, now this is His Excellency, my boss who is speaking, the Nigeria Health Sector Renewal Investment Initiative through the Ministry of Health and Social Welfare, which is anchored in a sector-wide approach and the Basic Healthcare Provision Fund.
Nigeria Population Commission reaffirms the report's recommendations as integral to national policy, highlighting the urgency of conducting a long-awaited census. The UNFPA is urging increased investment in sexual and reproductive health as well as enhanced sex education as part of the solution. Rebecca Goffey reporting for BTV News.